Hi, it's Dr. Dave Morris with Magnolia Medical Center and MagMed TV. Today we're going to go over something that is extremely important, something you're never going to hear from your pharmacist, you're never going to hear from your medical doctor. Very few people know this, but it is extremely important if you take even over-the-counter medications, much less prescription medications. So this is an extremely important piece of information that you're going to want to know for you and your family members. Keep watching. Okay, so today we're going to talk about genetics and medications, okay? So I'm going to try to keep this short, but this is something that's really important, something that you need to know. It has to do with you, it has to do with your family members, and it has to do with your genetic makeup and how you respond to medications. So the best geneticists in the world, the people that are paid the most money to study genetics are the people that are paid by the pharmaceutical companies to study how your body is going to genetically respond to the medications that they're trying to create in a laboratory. Now, what's interesting about that, and what you really should know, in addition to how you might respond to those medications or any medication, is that those geneticists actually skew the results of how a drug comes to market. So if you are involved in a study for the efficacy and safety of a medication, and before that drug comes to market, and the drug company can know ahead of time whether or not you're going to respond well genetically to that medication, they can exclude you from the study, therefore skewing the results of the study. I mean, they can prove that their drug is safe and effective by excluding people that genetically will not do well on that medication. And this happens all the time. The best geneticists in the world are employed by the pharmaceutical companies to make sure that to have a better chance of their drug coming to market. And then you might say, does that really happen? Well, if you do a 23andMe or an Ancestry.com test, and you have a clinic like ours or some other clinic, or even find some of the interpretation software out there yourself to tell you how you genetically are going to respond to medication, you'll find that what I'm telling you is true. So I'm going to give you a little bit of a quick story. I had a patient come into my office last week. We got a genetic report on her. She takes a blood thinner. Now, what's interesting is there's different types of blood thinners available on the market, and she's taking Plavix. And on her genetic report, it actually said that she responds well genetically to Plavix. But there was another blood thinner that she would not respond well to. What's interesting to me is the doctor could have just as easily prescribed the other one. He wouldn't have known. The pharmacist would have known. She had never had any genetic study done before when she got put on the blood thinner medication. So if they prescribed the wrong one, she wouldn't respond well to it. She could have a reaction to it, or it might not even work. So wouldn't you want to know that before you start taking a medication? Lots of people actually have a genetic a mutation, if you will, genetic mutation that makes them not respond well to aspirin. Simple aspirin, a baby aspirin. You could be giving a child a baby aspirin, and they could have a reaction to that because they have a genetic disposition, a genetic makeup that doesn't allow them to respond well to aspirin. So this is important because when you go to the doctor, do they ever ask you, hey, we need to check your genetics first to see, are you going to respond well to this medication? Can you even take this medication? That never happens. Your pharmacist isn't asking you, but you should know this. It's extremely important. You can get a genetic test from 23andMe or Ancestry.com for $200. There's clinics like ours that can help you interpret that and help you get reports on that. We're not a fan, just to be clear, we're not a fan of medications. We believe drugs and medications should be your absolute last resorts. That's what we believe in our clinic. Nutrition, supplementation, chiropractic, acupuncture, what have you, all should be done first before you do drugs and surgery. But if you're going to go the medication route, we believe you should know, are you going to respond well to that medication? One of the, I know I'm going on here, but this is really important. One of the classes of medication that is the most studied genetically, but you never hear about it, is psychopharmaceuticals, psychotropic medications. So many people have genetic makeups that don't allow them to process those medications properly, and it can lead to huge problems. Those medications are dangerous as it is. They have black box warnings on the box that says how dangerous these medications are. It's a black box warning, yet nobody ever checks their genetic makeup. And you have people that are shooting up schools or going crazy and shooting up movie theaters because they're on these medications or trying to come off these medications, and nobody ever looks at their genetic makeup to see can they even metabolize or process them. So folks, we believe that you should be checking your genetic makeup before you take any medication. You should get your genetic makeup and take that to your doctor if you're taking medications. This is really important. I appreciate you watching. We hope this helps you. If there's anything we could do for you, please don't hesitate to give us a call, comment below. And what we really appreciate the most out of anything is you watching and then clicking that share button. Please share this, get the message out. We want to change people's ideas and their knowledge about health. Thanks for watching.